Good morning, everyone.
Good morning, Kevin. How are you?
I'm good.
I said this a bit earlier, but if everyone could, for my roll call purposes, just drop their name and group in the chat. Um, and then Alicia said as well, if we could have everyone state their name when addressing the group when we start discussing so that we get that right for minutes, that would be very helpful. Thank you very much.
And if I think the most important thing, if there's a motion or anything like that, that's especially important to know who said what, for sure. Thank you. Okay. Okay. I know that the chairs and vice chairs are all on right now, so if we can find out if we have quorum.
I believe so. I'm double checking the roll call right now.
And be for both counts, each council.
Yes, so we have
Thank you.
7.
Good morning, everyone. Happy Friday.
Good morning, Judith. How are
Good
you?
morning.
Wonderful. Glad it's Friday.
Okay, I do believe that quorum has been reached.
Okay. Do you need to do a roll call? That'd be fine too.
Yeah, I can start with providers. So we have Kevin, I saw. Do we have April lot?
Yes.
Yep. And then Steve blank. Do we have? Yep. No. Good morning. Um,
If you
Lariana is
state their
here.
name, everyone can just say yes, they're here.
Okay, so Kevin's here.
Here.
Yep. April
Here.
here. April's here. Steve. I didn't think we have Steve. Do we have Andy or an alternate?
Here.
All right. Good morning. Lariana, who I know is here. Erica? Okay. Zach, Lieutenant Zach.
Here.
Aish, good morning. Michael.
Kip Corriveau for Michael Gilazzo.
Yeah, good morning, Kit. Christine.
Carrie Roll covering for Christine.
Thank you, Carrie. Ashley Lowry. Okay, and then Dolores.
I'm here.
Dolores is here, and Mickey, or an alternate.
I'm Sasha St. Felix here for Mickey.
That's what we got, Sasha. Okay, and so just really quickly, funders. I know Sandra's here. Sandra's here. Arrow, I believe, saw Arrow join. Yep. Do we have Janine yet?
Yes, here.
Good morning. Celeste, I saw. Amy, I saw. We have a rep for Blossom, if I'm not mistaken. Yep. Elise, has Elise joined yet? No, Elise. Danya? Okay, and then Joe Riddle I saw has joined us. Do we have Julie Rocco? Elizabeth or an alternate? I think
I'm
it's
here.
not- Yeah, Lizzie's here. And then Anne Marie Winter. Okay, and then I saw Karen is here.
I'm sorry, did you get Celeste Fernandez,
I
DCF?
did get,
was
yes,
okay.
I sure did get you.
Thank you, ma'am.
Absolutely. Thank you. Okay, so we do have quorum reached for both. Thank you guys for your
Thank you.
patience.
Thank you. Okay, Chair Sandra.
I'm up. Good morning, everybody. Welcome to the Funder Provider Shared Council meeting. I think I just renamed it, so my apologies, but welcome and happy Friday.
Happy
And we're going
Friday.
to move on to the next part of the agenda.
You want me to take that?
I think so. I'm not sure. If
Okay. April, do you want me to take the consent agenda? All right. All right. Well, we have our consent agenda attached for both the previous funders and providers council meeting summaries and meeting minutes. Do I hear a motion to approve the consent agenda as presented?
I'll make a motion to approve.
I'll second.
Got a motion, we got a second. Any opposition? All in favor, say aye. Or
Aye.
raise your hand. Any opposed? Consent agenda is passed. On to the HOPWA funding allocation and approach. Is Avery here with us?
And Kevin.
There she is.
I'm here. I'm here.
All right.
Hey, good morning, everyone. I will not take up all the allotted time. Unfortunately, this is a work in progress with HUD right now in Cloudburst. For those of you that are not familiar, HOPWA stands for Housing Opportunities for Persons with AIDS. This is the only federal program that is dedicated to housing needs of low-income individuals that live with HIV and AIDS and their families. It offers a variety of services, anything from tenant-based assistance, emergency rent payment to supportive services, which can include health services. Currently, right now, Pinellas County residents that receive HOPWA are receiving that funding through Tampa. The Tampa is the current HOPWA entity that oversees this program for Hillsborough, Pinellas, Pasco, Hernando, and I believe Manatee. So what they do is they do the same thing that the city does when it comes to our annual allocations for our consolidated plan with HUD, which would be for emergency solutions grant funding, for your community development block grant funding, and your home partnership investment. You have public notices, you have public meetings, then you put out your RFP after several months. The RFPs come back, and then your committee votes on it, and then the consolidated plan or action plan goes to city council after a 30-day public period, and it's approved, then submitted to HUD. We will be incorporating HOPWA into our next round of funding. So we were awarded $1.7 million in HOPWA. And what we have learned that is that is literally the cutout for Pinellas County from the Tampa award. And what they have done over at HUD is they have literally created a new service area for just Pinellas County. And we were awarded those funds for that. Now, Tampa is still going to be running in those other counties. We will be only serving Pinellas County. And that's really important when you look at HOPWA, because that was something we were confused at, that we were going to be competing with Tampa and having also to serve all those surrounding counties. HUD has since clarified that. What we are going to do for this current fiscal year is, because Tampa has already gone through their competitive process, we will do an interagency memorandum of agreement with the city of Tampa and provide them our funds that are needed for the agencies that are doing the support work here in Pinellas County. So that will still continue for this fiscal year to be managed through the city of Tampa. What we'll do from what we're currently doing now through January is planning. We're planning with HUD, with the technical assistance providers, with the Ryan White Council, the Regional Ryan White Council, and we're working on what would our HOPWA program for Pinellas County look like? What is needed? We're in the middle of gathering all the data, all the needs, and looking at all the reports to see what is needed. We will do public meetings. We will tap into all of you, ask what you've all seen and what your needs are that you've seen, so that when we do our public meetings in January and then release our RFP, it is reflective of the true community needs when it comes to the services that will be offered. So, like I said, I don't have much to go on with it. What I can tell you is that when it comes to HOPWA for localized support, there are some general criteria that needs to be met. So that obviously, first and foremost, is the medical diagnosis. It has to be that individual or an immediate family member has to have a verifiable HIV and AIDS diagnosis. Income needs to be at or below 80% of the AMI and need. There needs to be some need showed of housing instability, whether that's homeless or at risk of eviction, or even transitioning from marginal housing. Those are the three things that need to be met. HOPWA is very flexible in a lot of their eligibility and in their providing services, and surprisingly, thus far, has not come under many stringent guideline changes that we have seen with other housing and homeless programs over the past 2 years. Again, we meet every other week with HUD and our TA provider, and it's just about setting things up right now. So with that, I'll open it up to questions. Again, unfortunately, we don't have a lot. Through our technical assistance, it's like little nuggets get released every 2 weeks to us. And right now, we're currently just in a very heavy connection time and data collection time and analyzing the data. I do know that I have run across that there is a really important critical piece where we will need to meet about coordinated entry and HOPWA. And so that's something that I can see coming back to probably providers over at first so that we can talk through what does that look like for Pinellas County? Do we even incorporate that? Don't we incorporate it? Because there are options. So that would be one of probably our first things as a continuum of care that we would do. And then also just letting you all know about this new program that's coming out and the availability in January and February. So I'll step aside. I'll see if there's questions, and I hope I have answers for you. Oh, I have Karen and Arrow that I can see.
Go ahead, Arrow. I think you were first.
I had my hand raised for voting on the consent docket earlier, and I guess it didn't let me, so I apologize. Didn't realize it stayed up that.
Thanks, Arrow. Okay. Hi, Karen.
Hey, good morning. I don't have a question. I just want to say, Avery, if you or your team want to meet with us for the Healthcare for the Homeless program, we do screening for that population,
Yep.
and we have some reporting that we could probably assist with.
Thank you, Karen. You're already on my list.
Yeah, thanks.
As a board member, you're already on my list. We'll be connecting soon. Are there any other questions? Okay, we will provide you updates as we are learning them. So I can let Sherry and the HLA team know when we get more substantial information to bring it back to you all. Because the main thing for me is to make sure that the continuum of care is aware of what's happening with these funds and how we're moving through them and what we're looking to set up. Because I want to make sure that it does reflect the needs of the county. Okay, thank you, everybody.
Thank you, Avery. So the HUD CoC program NOFO, as everyone knows, was released June 1st. And on Wednesday, we had our applicant conference, and all local materials were also posted to the website. I'm going to put that in here in the chat. Or actually, just in case I don't want to misspell it, Alicia or Mimi, if one of you would do that, that'd be great. Thank you to the funding landing page. So all materials are posted, and most of what came about we expected, we've been planning for, and so the tier 1 is at 60% annual renewal demand. That is more than what was being posted during the fall and the winter, less than what we've historically had available. But that's where that is. And for anyone who is not aware, annual renewal demand, that's all of the renewals that HUD forwards that are currently in existence that's HUD funded for the CoC program. And so 60% of that for tier 1 means that that's less competitive. HUD is saying it will not be competitive, but it is less competitive at tier 1. And so those are safer, and tier 2 tends to be less safe. And with this NOFO, we know that there's going to be high competition across the country. And so it's going to be very competitive for tier 2. The application's due August 26th. Our timeline has that we'll be submitting August 24th. All of that is posted on that website. And some of the HUD priorities are increasing competition, improving outcomes in general, and especially focusing on promoting self-sufficiency and earned income, reducing unsheltered homelessness and encampments, treatment and recovery, service participation, and public safety. So We do have some preliminary estimates on what the annual renewal demand is and what may be in our bonus. If you look on that website, there's a PowerPoint that goes over some of the estimates. They're estimates right now because the grant inventory worksheet. I didn't want to use an acronym. The grant inventory worksheet, HUD is still working on that. It has not been finalized. They did send them out and ask for any corrections that need to be made or if we know of any errors. And so we are really looking through that very thoroughly because we have heard and we've actually identified one error, but that is a common occurrence. It's happening across the COCs in the country. So that is going to be, that's due on Monday. And so we anticipate to have final word from HUD on what all of our COC bonus, DV bonus, all of those amounts are. But right now, the estimated annual renewal demand is 6.429 million. Our COC bonus project amount that we estimate is 1.165 million. DV bonus is 1.554 million. And planning project 388,000 for a total possible of $9.5 million. The tier one amount at 60%, we're estimating to be around 3.857 million. So 3,857,448 is our estimate. Some questions that applicants should definitely be asking because there are providers here, and it's also important for funders to know too, and that is for tier one, which is the most protected, that we identify and you identify as providers or anyone who's going to be applying, because that could be local governments as well and faith-based organizations. If you're going for a renewal, pick out the most important projects that we really do need to protect for our system. There are transition grants available for or transition options, 1-year transitions for existing projects to transition over for a year into transitional housing. And there are also new project options too. So that 60% is going to have to be very strategically used for what this local COC needs to maintain. And so are there any questions about the NOFO at this time? Because there are a couple of areas we need to focus on. So that have to do with policy as a result of this NOFO for this body to discuss.
Sherry, this is April. So, with the reduction in tier one and what you're saying in terms of, make sure that you put your most competitive projects in tier one, that kind of thing. I mean, I'd just like to hear from Kevin. I think the majority of our tier one, right? Like, I don't know if you guys have the screen that we could see about who's in tier one, but what are we anticipating? Kevin, what projects are we going to lose, or what projects are going to go to tier two that become highly competitive?
So no permanent, so PSH and any permanent housing, permanent supportive housing and rapid rehousing, because of the way that HUD is going through set aside amounts, which is under litigation right now, but it's the set asides that are available. Once those set asides are spent down, then they go to the next category. And permanent housing, even though it's above transitional housing, we're anticipating, of course, across the country that permanent housing, everyone's going to be putting that into their tier one. That those projects are going to be prioritized for tier one. And that goes against the set aside, or goes, against the balance of the set aside. And so transitional housing and supportive services only projects are going to be the most competitive in tier two.
I guess to jump in and answer your question, April, our priority at BOLI is to, preserve and protect the highly vulnerable in permanent supportive housing and safe haven. For the reasons of the population, and they're truly the ones that need that ongoing support. I believe our system data, still seems to reflect that there's over 500 people age 62 or, and above. And that's a majority of the population that's currently in permanent supportive housing. But I think the other note is just, the millions and millions of dollars that have been invested over the last 15, 20 years by the city, the county, in all of these buildings, that, would, pretty much, you know, get boarded up if we lost the operating support. So that's my thing. But we are strategically preparing for reductions in that, and we are trying to figure out, how we can streamline it and manage it with less dollars should through the reallocation and rank and review process dollars need to be trimmed. We only plan to push forward our two PSH projects, our two large PSH projects, which support all the brick and mortar. We do plan to not push forward Shelter Plus Care or our smaller PSH project. Just to help to support the change and the shift and the need for dollars to be able to support a more diverse portfolio, because when you really look at the NOFO and the direction things are heading, they want more diversity and interventions, and so we want to help to support those causes.
That's amazing, Kevin. How are you going to, I mean, not that it's my business, but how are you going to continue to support those projects that aren't then going to be prioritized to move forward?
Um,
We're not going to close them.
no,
Okay.
the small one, fortunately has operating vouchers, so it's just a matter of a couple staff. So I'm going to try to figure out how to absorb that and other revenue streams. The Shelter Plus Care, I don't have a good answer for that. I do believe that we'll be able to potentially transfer some of those Shelter Plus Care to other voucher programs, but I don't have the full map of that yet. But our goal is to try to keep as many and all of them housed as possible. If I'm comparing PSH for Shelter Plus Care, Shelter Plus Care are lower level, like they're not in services at all. That Shelter Plus Care is simply rental assistance, and
Right.
they're not in services. So obviously, if there's not enough dollars, I want to protect the ones that truly need those services to be successful and stay sustainable in housing.
Kevin, I'm sorry, this is Avery. I'm going to interrupt very quickly. We are here at the city providing some funding to switch some of the Shelter Plus Care
Mm-hmm.
over to TBRA vouchers. So we'll be
Right.
doing that through Home Partnership. We've already done a little bit of it, but we're going to continue to do some more
Correct.
for him.
And that's been the plan. We've been working on that plan for a while, seeing the writing on the wall. We've known this has been coming for over a year. So, we've been preparing for Shelter Plus Care dollars to be able to come back to the larger needs of the system, because we are going to need to invest in some other types of projects and interventions.
Ariana.
Hi there. As the other holder of the majority of the projects, our projects are largely rapid rehousing, which is considered permanent supportive housing. But we do understand that Kevin and Boley, they have limited options for permanent, and probably the majority of the projects should fall into tier one. We just ask for the same consideration that Kevin had talked about investment into the facilities and the buildings, but also from our perspective, investment over the last, 8 years into DD projects to get those up and running. Our plan is to try and utilize the DV bonus, and as we pull our projects from really a lot of competition in Tier 1. We just ask for consideration from the CoC to prioritize our projects that have really shaped the CoC in this community and to help prioritize those in other areas other than the Tier 1, so we can reserve that for Kevin and those bully projects that really don't have opportunities anywhere else.
Lauren. Any other questions before we move to some housing focused language that was brought forward by funders?
Jerry, has a rank and review committee been sat yet and have dates determined?
It's going to be the week of July 21st. And so all rank and review members, I've been reaching out to make sure we've been looking at offering terms that are extended beyond this time, but don't want to impede anyone's participation for that reason. So it is same review and rank that we have a good list of folks. One of the concerns is that because of the way this NOFO came out with new areas that open some more things up, it may be some people who are going to be in review and rank may potentially become applicants themselves. So it's good that we have some alternates. Going to be leaning heavily on them. Okay. I don't know if Sandra, are you still on right now? I know that she had to leave a little early today.
I'm here.
Okay, very good. Did you want to take over the housing focus language piece, or?
Sure, but at the same time, there's a plumber behind me digging up a drain. So I'm just full disclosure.
I'll jump in as you need.
Thank you. So what's shared is what we discussed at the housing, the Funders Council meeting. We met briefly earlier this week, and I appreciate everybody who could get on that call. Essentially, it's just really trying to find uniformity and consistency among all the funders, that were in alignment for language used. I know there was a big push over the years to all be in alignment around housing first. This is a kind of an accepted term across the country, a housing focused language. I believe St. Peter's already incorporated this language into their funding request, but this is the language that we all agree would be best aligned with both HUD's changes, but also just keeping some consistency throughout the county and the different funders. It gives examples of how it can show up in an application without saying housing focus, but things that a provider might use as language to indicate to the review committee that this is still in alignment and really focusing the work and services on housing, and ensuring that it continues to be strength-based and client-focused and all of that kind of stuff. So this was agreed upon by the Funders Council to go forward to this body, but also to be approved to be into the board of directors. I think, Sherry, you were going to check if that was going to be required, but we're just going to go along that process until we hear otherwise. Does anyone have any questions?
I don't have any questions, Sandra. I think this is great. I think this is fantastic. And I love the, can be strengthened with companion terms. I love those companion terms. So do we need a motion to approve this here, Sherry?
I think that the most important thing is so that we can move forward to the board, that it's going to be in alignment with HUD, replacing housing first approaches with a housing focused. So coming up with that language. So yes, it'd be good for input at least. And if the general group agrees, then it can move forward to the board meeting.
This is excellent. I make a motion to approve this.
Yeah, second.
Great. Thank you both. All in favor?
Aye.
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 All righty. Thank you.
Okay. Okay, thank you. Proposed COC, another policy to promote substance use recovery. That was included in the original agenda packet. And uh, so this was discussed with executive committee. I know, April, that you had some questions around number uh, number 3, I believe it was. Let me flip. Yes, number 4, I'm sorry. The second half of number 4, I went back. It does all of this is items 2, 3, and 4 are directly pulled word for word from the NOFO. This type of policy is worth 10 points, and it's also because it's being prioritized by HUD at this time. And so this is about coming up with a COC policy for any HUD COC funded housing projects to not engage in what HUD considers harm reduction. And that's listed on top. Encourages also the provision of substance use disorder treatment, recovering housing within or outside COC. And it will not restrict or prohibit housing projects that require program participants to be sober or participate in treatment as a condition of housing assistance. And this is the area where it sounds a little weird because it should be noted that, and this comes straight from HUD, it should be noted that none of the above constitute a requirement that program participants must be sober in order to receive assistance, participate in treatment in order to receive assistance. That's the big one that there's been confusion, or be evicted. That participate in treatment in order to receive assistance, it's also saying that we would allow those practices, but it's not requiring those practices. According to this NOFO, it is not absolutely required. Arrow?
First question, Narcan distribution, is that a gray area?
It's still a gray area. There are questions out to HUD on that. But it's a gray area, but we're using the exact language that are in quotes on the first paragraph, knowingly distributing drug paraphernalia and distribution of illicit drugs. So I know some people think it's gray. I think that pretty much
Well,
defines what they're
Sherry, the reason we think it's gray is because the workshop that Marbert, I think most of us were in attendance of that, right? I mean, he flat said it. He gave statistics. He gave all the data, right, about the use of Narcan is keeping people using and misusing, and I mean, he went on and on about it. So,
and there are areas that he did share a lot of that, but not everything that he brought forward during that meeting came through in this NOFO.
True.
Yeah, that's so we.
He does present himself though as the authority, right?
Mhm.
In terms of his relationship and proximity to the decision makers relative to all this. So
He definitely does. He is. But the other thing that he also stated was that there are some policies that will be coming down the pipe that have not been approved yet. Some policy will be made through this NOFO, and then after that as well. They're getting through some litigation. And so I don't know that we don't need to jump the gun necessarily right now on something. Yeah.
Fair enough. Fair enough.
Yeah. Thank you. Michael?
Yeah, so there is some discussion going on in, I don't know what we're calling it now, the harm reduction community that I want to know if the interpretation is to not have harm reduction practices in projects, because there is some discussion going on that any agency that offers any kind of harm reduction services would no longer qualify for funding.
That's true. That
That's
the latter
true
is
in
true. Yeah, it has to do. They're not limiting this to if you receive HUD funding to for a project, it would apply to the entire organization.
so that you can't offer housing if you're offering a program unrelated to your housing related to harm reduction.
Yes, that's what's stated. I will pull up the exact language and make sure to share that.
And Sherry, is it harm reduction specifically as it's listed here, like operating drug injection sites and
Yes.
paraphernalia? Because I believe our ordinance, as well as our drug paraphernalia ordinance, does not, we've eliminated, like fentanyl test strips are not considered paraphernalia in Pinellas County. So I wonder if it's specific to safe injection sites versus a syringe exchange and harm reduction education.
Drug paraphernalia would be syringes.
They're
know?
not syringes. They're not considered paraphernalia. And
That's
if
gonna
there's
be a head
additional work that
question.
we need to do,
Yeah.
Michael, maybe we can, you, me, and Tim can meet to kind of take another look at our drug paraphernalia ordinance that we have. But I do not believe syringes were included. We eliminated fentanyl test strips last year in our
Well, I
ordinance.
also think that syringes were eliminated as paraphernalia on the state level a few years ago now.
I believe so too.
And part of the, the Infectious Disease Elimination Act expansion, syringes were removed as paraphernalia, because it was added, I don't know, 15, 20 years ago for a different reason. So that was removed in that legislation on the state level. So that's why we changed it on the local level. The fentanyl test strips are a different discussion. Even though we may have removed it, I don't know.
Well, the
This
state,
will move. I mean, we have to make some decisions as it relates to other projects, for what we're doing. But I do think that it's important to talk about harm reduction education versus, but the distribution of Narcan and eliminating the distribution of Narcan, yeah, well, but I'm glad to have a conversation, Karen, off
okay,
in a different discussion with you, me and Tim.
sure.
I'm gonna put those questions forward to HUD. Any other thoughts on the language for the policy?
Is this something that we need to approve, Sherry?
I think we just
It-
need input, but just to be safe, if we want to do a motion on this one too, to move this forward to the COC board, that would be helpful. I'll cover all bases.
Do you think that we need more clarification on some of these terms before we do that?
I think we can, if we don't get this through, just with the language as it's stated, we may miss a window of opportunity. We can table. I can put it this way. It can go in front of the board with input that was just provided here. I can go find out some information and provide that as well when it's presented to the board.
Yeah, and I think what you're saying is that we don't have much choice. This is HUD language
That's
straight
one
out of
thing,
HUD,
yeah.
and it is what it is. If we have different definitions of this, that, and the other thing, we're going to have to find workarounds of some kind. But
This
for
is
HUD
direct
language, yeah, from
Yeah.
HUD language, right. So I would motion to approve it.
Thank you, April.
I'll second it.
Was it Arrow? Thank you. I can't lead the vote, so thank you.
Kevin, all those in
Oh,
favor?
sorry. I didn't realize yes, no problem. Who was the second? That was
Arrow.
Arrow. Okay, got it. So we got a motion from April. We got a second from Arrow. All in favor of this, please say aye or click the raise hand button.
Aye.
Aye.
All right.
Do I have any objections? I see hearing no objections. This motion has passed.
Hey, Kevin, I don't have an objection, but as just a point, I'm reading 893, 145 right now, and syringes are specifically mentioned. It goes into a little bit of a detail, but just something to consider. I don't think it's been completely removed from Florida state statute.
Thank you, Zach. Can you send that
Thank
to
you.
us or put it in the chat?
Yeah.
Yep.
Thank you.
Thank you.
I mean, I think that, we all feel the way we feel about harm reduction and the importance of it. But on webinars that I've been on, it's been very clear that, regardless of what you're doing now, if you've done it in the past, they can pull it out of what you propose and not fund it. And actually it could put the COC funding as a whole at stake. So, I think Sherry should ask some questions and maybe we can have another conversation, but I think we're all struggling here because we know the good that harm reduction strategies does, but the world we are in right now requires that we take a different stance if we want to continue to draw down these other funds to help our community. And so that's just the reality that we're in.
I have a question for Lieutenant Hayes. Does that, I know that you guys don't use COC funding, safe harbor, but does that affect things like your amnesty bin?
Say that again, Arrow. I didn't catch.
I know that Safe Harbor doesn't use HUD COC money, but does it affect your amnesty bin at Safe Harbor?
I mean, I have never had that discussion with anybody. Never even thought about it. So I don't want to tell you I have.
And this policy only applies to COC funded projects. So those will be projects that go through the HUD NOFOs and from DCF Unified Homelessness Grants.
Yeah, which we don't. Yeah.
Okay. Thank you. Arrow. We're having a hard time hearing you, or there's something going on with the microphone, I think.
Is that any better?
That's better.
Okay. I did just so on the bottom two, Sherry, you can actually hide the one time also if you want, so according to the other ones. So this is the funding spreadsheet I think we saw at our last group meeting together. We got some good input that we wanted to break out the any sort of housing development or housing rehab, meaning home improvement, not substance rehab, as a separate tab so that it doesn't show like it's this big, huge part of our homeless system. So that is on the third tab of homeless preservation and development, and it has been pulled out of these summary sheet tables now. So the next step that a lot of you helped on this week, because I can tell it's a big change in how many are listed as blank, but we really need everyone to go through and check the information that was in there and also make sure it's allocated, whether it was recurring or one-time funding. It looks like we still have about 1.8 million that has not been designated one or the other. And on tab 2, Amy, this looks like it's St. Pete items still, so I don't know if maybe you guys sent that in after this went out.
Yeah, I think y'all aren't copying Avery on stuff, and
Okay.
when you ask things to be turned in less than a week, Helen is
Right.
out, so you need to copy multiple folks and we'll get it taken care of.
We'll make sure,
Okay.
yeah.
So yeah, so I figured it was.
And I'm not sure if the pivot tables, I'm looking at permanent supportive housing on row 10, and I know that that's a higher number. So I was hitting the Control F5 to refresh, and it still wasn't coming up. I don't know if it's because additional rows were added with the more input that we received.
Okay, so for the mute and see a little bit.
Actually, if we can, would you like to, would you like to share your screen? Because I don't have access to.
It's a little hard to hear you too, Arrow. I don't know.
Okay, let me try and put my headphones and then see if that helps. Oh, why the thing doesn't go well. That any better? No. Okay. I will do my best to talk loudly. Is this any
No,
better?
That's better.
That's better. That's
Okay.
way better. Yeah.
Mhm.
I saw your expression, Shay. All right. So on the table, Sherry was saying that the PSH number looked low still. We need to look at that. Is that what you're saying?
Yes, it's higher in the second tab.
Okay. Okay. So we can, I did do a refresh on the data. So we can look at that and see as well. Um, there was one other thing I was going to bring up specifically. Oh, we still didn't see the VA information on here. I don't know if we can get that added. Oops, what did I just do? Are you guys seeing my spreadsheet still?
No. Are you able to share it
Okay.
on the screen?
Yeah, sorry, somehow it blipped off. Okay, how's that?
It's coming.
Okay. Um,
There we
so
go.
the other thing I think we talked about at Funders Council the other day was that it would be good to see if we could find out how many people are enrolled in, I think we were talking about using HMIS rather than PIC, correct? For the different programs, so we can
Yes.
kind of get a little bit more per capita cost or how much is being currently invested in that. And also that helps us look a little bit too, like for example, our individual homeless population is much larger than family homeless population. So yes, it may be a bigger amount of money, for example, on programs that are going toward adult homeless or individual homelessness versus family, but there's a reason for that if there's a big skew in how many clients there are to serve. And then, so I think our point with doing this too was to be able to provide some information on what it's costing the system currently to run, where our funds are invested. Like if we get, uh, you know, our elected officials are wanting some of this information. So I think it would be helpful, Sherry, correct me if I'm wrong, to get a little bit of feedback today too on if we're still missing anything or what format we really want to put this in some sort of maybe a one pager with some just key highlights, not just put these tables in, but something like what are the important things that we need to tell with this data if someone's asking for it? Anyone have any thoughts on that? I think one storyline might be that we do take the one-time data from all of our CoC, because a lot of it's either COVID or hurricane funding. And I think we need to tell the story like our system has been supplemented by this since 2020. And so overall, the system's benefited by having that in comparison to the proportion of what is recurring funding. And as I said before, we discussed kind of maybe the per capita cost on some of these. I know, Kevin, before on your permanent supportive housing slides from a few months ago, you were able to show like the cost of, a stay at a hospital, at a jail, for your PSH and things like that. Safe Harbor's had that information too before comparing Safe Harbor to jail overnight costs and things like that. I think money-wise, that's probably an important factor to be able to explain that component to to the return on investment, I guess, to put it in better terms. Anything else anyone can think of that would be good to, like, what questions would our electeds want answered? Maybe the effectiveness, like, what the placement to permanent housing is with some of the programs. I don't know. Are there any hands raised? Everyone's so quiet
I don't
today.
see any. Okay, we have finally in a chat.
Oh, okay.
Lieutenant Hayes, FY26 daily cost of an inmate rate, 178, almost $179. And the daily cost of safe harbor resident is 40. That's good information. Thank you.
Absolutely. And to that effect too, I mean, the jail is at capacity, right, Lieutenant Hayes, if not over. So mitigating populations in more proactive ways is critical. Among other reasons why to do that, of course, but the other thing I think might be helpful, because I've heard this narrative recently on some of the news stations. I think we have to be able to explain what the inflow into the homeless system is, because this homeless system, aside from prevention, right, or maybe diversion, is keeping people out of the homeless system from entering, so to speak. But how many people are coming into the system versus leaving? We have our inflow outflow data. I think it's important because there's other factors in the community that are affecting why people are entering it to begin with, which may be beyond what the overall homeless system is able to address. I don't know if anyone's got thoughts on that. Like, Karen, do you think that would resonate at all with electeds?
I mean, I think a couple months ago, yes, I think we're just in a different space right now with the whole property tax thing, to be honest. So
that's true. So that is one component to this that we may want to say, like, not only of the $16.5 million, how much of it is general fund? And that was another thing we did talk about at Funders Council, was adding we added a new source column. Thank you for bringing that up, actually. Karen, I forgot. So we added a new column here for federal, state, and local, because it's not just, the counties and cities. JWB is also one of the one of the millage rates that will be impacted by the tax reform as well. So that would be probably another good thing to show, like, here's how much of our money, here's what comes from federal and state and local to support this. So what potentially could those impacts be if there is reform as well? Anything else?
Arrow, I would say, as I look at this, I would like to spend a few minutes with the tabs and whatnot. But if I were, I don't know, a policymaker, a decision maker, something, I'd want to know why we're spending so little on outreach, for example, and what could be done. I mean, if we're talking about inflow and outflow and other things, it's system coordination and infrastructure. I mean, the fact of the matter is that we don't have a front door, right? We do not have a front door. And so, again, I don't know that this gives us the picture. I mean, I think it suggests that we do have a front door. Like the number of people who say to me, who've been a part of the system, by the way, for a long time and still don't understand and or get that we don't have a front door. And that there's, 17 different doors, and it depends on how tall you are and the color of your hair and the day of the week. But system coordination and infrastructure, I think, would suggest that we have a front door. I don't know, if that's what, I just don't know if everybody who would be reading this would know what that is, and that we should be prepared to speak to, why we don't have a front door, why we spend so little on outreach in particular. And then I do think that we're going to have to wrestle with in the future, kind of the treatment and the lack of an investment into treatment, which of course has been aligned with we didn't have a service requirement. That went away under Housing First. That was intentional, but now we're shifting back to a service requirement and treatment being a priority. We're going to have to wrestle with some of that.
We do have the
Especially,
10.3 million though in there with the healthcare medical services now, as Karen mentioned. A lot of that is general fund, but and
yeah,
also like SAMHSA grants and so
Can
forth
we
too.
dig into, though? I think April makes a good point. Can we look at, I know you have this sorted right now, but can we look at system coordination and infrastructure in a little more detail so we understand what that is? And is that what we're hoping accomplishes our front door or not? Because it's an important thing for us to consider as we fund future projects.
So, and Sherry might be able to, well, some of this is St. Pete, it looks like, and then, so I don't
This
know if the difference
is
is one.
HLA operations, the homeless helpline that goes to 211, I believe. And then some funding that comes, so ESG funding from City of St. Pete, that's for, I believe that's for HMI, that is for HMIS. General funds, that is to HLA. And then the two HUD options down below, we have HMIS and planning.
It's more the COC coordination. Overall, it looks like. I see.
Yeah,
And these are like the planning project that HUD funds, and HMIS coordinated entry is actually not showing up here. It's showing in as system coordination under stage and system, but or it may be case management. A lot of the activities that HUD funds for coordinated entry directly is around some like navigation, and it was going to be kind of a split up. In order to remove it from other, I just put, I believe, case management and landlord liaison, because that does find quite a bit of it.
Okay. I see.
Okay, that helped Arrow to kind of understand what's behind the numbers.
Okay. I do think that street outreach number is very low, because with salaries and benefits and vehicle and all that stuff, it's like so.
Yeah, I'm just wondering if this, and so like I said, the PSH is not, that's much lower than what was added. So I'm not sure if these are.
Okay, I'll take a look at it and see if I can check the ranges on them and see if they're pulling the same range. So at our street outreach meetings, I think we have like 20 or 30 different entities, it feels like now, represented on that. So we're missing a lot. I mean, even Salvation Army has now, and Bully's got different groups out with the Firefly Project.
I mean,
So
it
many
doesn't,
different groups
it certainly doesn't include, I mean, for sure it doesn't include most of us, right? Like I have 5 or 6 street outreach people on the street every day. I mean, that's not included
Right.
here, but I wasn't asked to give that information either. So I don't know, I don't know what is included in these numbers, but just trying to answer your question about presenting to, decision makers and policy makers and those kinds of
Right.
things. I would have questions about why we don't have a front door. I'd have questions about street outreach. I'd have questions about treatment. I'd have questions about some of the things if the direction that we are being provided now is the direction that we need to be going in. Some of this is not aligned with those expectations is all I'm saying. And that, I would have questions about, well, how are we going to get there? How are we going to turn this barge? These are very aligned with the investments, as these investments have been very intentional and very strategic, aligned with a housing first model. And now that model is shifting, these investments aren't going to be I don't think as well aligned, and or we're going to have to give it more narrative.
Do you think we need to send this out to, I think we had sent it a lot to the providers to list what they're funding, but it sounds like we're missing a lot from from the funders. Sounds like we're missing a lot from providers, whether or
Yes.
not there's private sources going into funding some of those services, or some of the funders may have not put on certain ones that are funding. Like if you've got 5 or 6 street outreach that are not shown on here, we may be missing those, whoever it is that's funding that.
Don't want to speak for Sherry, but I think it's been going to funders. I don't think it's been going to providers.
Yeah,
I think some of the things that are missing, for example, I don't know what this $110,000 is, but I think what we were originally instructed to do is put funding that we are putting out to other people. The city is funding its own street outreach team, but that's not money we're giving to anybody. So that's not showing up here. And so, if we want a more complete picture, we just need to provide different instructions.
Yeah.
Because I think there is a lot of things that government is funding internally. Karen has a substantial team, for example, that wouldn't be showing up here because that wasn't the instructions provided.
Okay. Does everyone concur then we should send it out to funders and providers, and for jurisdictions to include their own staff costs that they're funding toward those, like for street outreach and so forth?
I agree. I think it's necessary, and I think City of St. Pete and the PATH team and all that they're doing, that they're funding internally, and county too, should be on here, especially if we're talking about like tax reform and everything's going to go away, and it's like, well, when we say there's going to be this dramatic reduction to providers, it's like, well, I'm assuming there's going to be a dramatic reduction to the city of St. Pete, to Pinellas County, to the city of Largo, to whoever, right? It's not, so to speak, just providers. It is an entire system that's going to be impacted. And we need to know that. And I would assume our policymakers and decision makers and others also need to know that.
A good point. Joe?
And this has evolved. So what it started with from is moving in. Yeah. Now that we're talking property tax reform,
Yep, for sure. Joe?
But what I fear, and I don't disagree that we need to go to the providers, but the providers need to understand they only need to put that funding that is not showing up on this sheet, their private foundation and those things. We could end up with a lot of stuff duplicated here because the provider says, I got money from the county and I'm going to put it on my sheet too. And then we end up with, a duplicative amount. So we got to be very clear when we send this out to the providers that we ask for, unduplicated amounts that don't show up here.
And it may be difficult to tell. it may be difficult to like pull that information because we're not asking for every single, it's not asking for every single agency that's funded. It's asking for what funding is being provided for what project types and funding sources. And it's not listing the organizations
Yeah.
where those funds are going.
But to Joe's point, if we can add on, I would say for our providers, any of your private funding, whether it's through fundraising, we can count as private foundation. We could just make that be private, I guess. So any of your fundraising, any foundation grants, and then also if you get any direct funding, like through state or federal, that is not from one of the funders here. Would that make sense? So if so-and-so applied for a direct state grant on something,
Yes, it
and they
does make
got
sense.
that, include that, just don't include if you have a contract with St. Pete to do something. Assume that St. Pete will have added that. Does that make sense, Joe?
One other, the other thing is we had in our last meeting that we talked about when we had our $74 million number on there that was in the system, and we know that was inflated. But again, we're getting back to a number here of $20 million in the system. I know a lot of it is one-time funding, but in this new environment we're fixing to get into or that we're into, you know, people are going to look out here and say, hey, the system's got all the money they need. We don't need to worry about it. That may be a place that we can go get money from. So I caution a little bit about how we present this and everything because, again, those are big dollar amounts. We know it's not enough, but for the uneducated, they're not going to understand that. So I understand getting everything out here, but again, I caution in this new environment we're in, it could be a disadvantage as well.
Well, I think that's where we can tell the narrative too, that like we've benefited from the supplement the last few years of that one-time funding. And now, so we're already going to have that impact to the system. And maybe it's listing like XYZ type of cuts that now happen after that one-time funding is gone, like how that affects the system, and then highlight some positive outcomes from where we have made those investments in terms of, number of people housed, the recidivism rates, or lack thereof. Some of the key data that can show that these programs have worked.
Arrow,
Yes.
this perspective that Joe has just offered us, I think um, is a brilliant one. And so perhaps, I mean, you guys have been discussing it at Funders Council. We haven't been a part of that conversation, but I do think that this perspective that Joe has just offered makes me rethink, even, for example, that I want you to send it to me and then I'm putting stuff on this spreadsheet, right? It's like, no. I'm not going to put anything on this spreadsheet if it's then going to become the target of, oh, this is where we can take money from. It's like, I do think there's a balance of what Joe is saying about who we're getting this information to, and if it looks like we're flush somehow with funding. Again, I think we may need to pay attention a little bit to what Joe just said. I don't think anybody needs to, we need people thinking that we're flush and, that we could do with 50% and they're going to take, I already think some of the things on this list, right, are already going to be, pretty big targets if property tax reform passes. I already think some of these things are going to be targets.
I think we could also, though, show, like I said, the data kind of on how many clients are served, like what's the per capita cost from the clients served, but even general, like overall, let's say for the general fund, the local funding tax dollars, for however many people are in this county, what's the actual per capita cost on local investments going into the homeless system. I don't know. I mean, my other fear is too, like if we don't have data to look at for this kind of thing, how do we realign ourselves with
Yeah,
new
that's true.
funding goals and know where we're going to be impacted if there are
Absolutely.
cuts to
I
tax funding.
agree. I agree 100%. I think this is a beautiful start, and it's incredibly helpful and informative. So please don't misunderstand me, Arrow. I agree 100%. It's just when we start talking about, like, doing presentations to people outside of us,
Mm-hmm.
that's where just based on what Joe just said, which is not something I thought about really. I think that's if we're going to be doing presentations, we're going to have to be able to demonstrate. I don't know that our overall performance is something that we can, I don't know, that we can celebrate, so to speak. I mean, we certainly have
Mm-hmm.
success, and we certainly have made tremendous progress. Don't misunderstand me there either. But I do think there's a long way to go. And anyway,
I'm gonna show, well, I hear all of what you're saying. So it sounds like this data is valuable, but would rather use it for, I'm trying to get that recurring to show again. Would rather use it for planning purposes here.
I think for now. I mean, what do you
Okay.
think, Amy and Joe? I mean, Sherry,
Yeah,
I think, yee.
It
I think
started
we
out
need
as for
this to
planning.
make decisions for planning. So yeah, I mean, this is going to be, we used to provide these updates monthly, and then talked about them in meetings, and so we're just kind of reinvigorating that process, and it's going to take us a little bit to get the spreadsheet exactly where we want it. And then I think a future step is not sharing the spreadsheet, but HLA creating talking points about, what are those things we're learning by having these conversations and understanding our funding and what's in the system. I don't think it's the spreadsheet we need to share with anybody. It's
Yeah.
where are gaps? What do we
Okay.
need?
Yeah.
Why is the system working or not working? That kind of thing.
Yeah.
Okay.
What would
But
be devastating if we lost?
yeah.
I think the sheet is a planning tool, but not necessarily something we should distribute.
Yeah. Okay. That makes sense. Well, I wasn't thinking we'd distribute the sheet as it is either. Yeah, I was thinking it's data that we use to help
Yeah.
formulate some sort of, yeah, the data when we need it for talking points or whatnot. But yeah, I was gonna try and see, I don't know why my spreadsheet's being crazy all of a sudden. I was gonna try and see how much was that one-time funding that we potentially will lose just from it not recurring. And I don't know why my sheet's not letting me do that at the moment, but
Dolores has a question in the chat, and
yeah.
so I don't know if that can be answered. I
I can't see the chat.
She wants to know if any of the cuts presented by the board by JWB yesterday affect or reflect on this data, or will there be any effects to these particular data points, is the question.
Janine, since not all of us are in the know, could you maybe
Yeah.
tell us what's going to be cut? And
Yeah, I can provide some information on that. Yesterday we did have a board meeting and our finance department did put forth 3 scenarios for our board to obtain some guidance as we move forward as we are developing our FY27 budget. So in doing that, our board selected the mid option, which is, I think, more higher than the rollback rate but not where we currently are. So we are looking at some reductions next fiscal year. And of course, depending on what happens with the property tax amendment, there is a potential based on the projections, because we do 5-year projections. There is a potential that moving forward, we would need to make more cuts in 28 to be able to bring our budget in line with what the anticipated cuts would be due to that property tax amendment. So, the cuts that we are talking about for next year have not been approved and finalized for our board, so they are not included in the information here. The information here was what we provided earlier this year, reflecting our FY26 budget. I'll stop and see if there's any questions.
Janine, I think because of the context clues of who's asking the question, I think it was the reduction to FSI is my guess. Because I think, and I'm not remembering the totals, but I believe there was a proposed reduction of like I'm going to forget the number,
Yeah.
but I think it was close to $1 million or $500,000 or something to FSI, and that there was going to be a change, relative to if just the context clues of who's asking the question. I would imagine that's more the question. Can you speak to that?
Yeah, of course. Of course. Yeah. At this point, as I said, what we have in the budget is proposed, and we are looking at making a cut to our FSI resource pool. I believe that cut we are looking at is about 1.5 or $1.6 million to the resource pool. And as we are cutting that resource pool, we are also looking at, cuts to our FSI system navigation providers. And with that, we're also looking at kind of realigning our two teams for FSI, as well as potentially expanding the length of services and kind of enhancing some of the services related to financial literacy, and really looking at a case management 3 to 6 month model. So as we are doing that, I know our providers are currently working on aligning proposals that they submitted to us, because there was some differences between our two proposals that we received. So currently our Gulf Coast team and our Elios team are working to align those proposals for services for next year, including some of those additional items that we are hoping will provide some longer term stabilization for families, and also address some of the financial challenges that we are seeing with families coming through FSI that are not sustainable, and really making some decisions that are creating a cycle for them where they are struggling to meet their basic needs, using a lot of payday loans, payday advances, and really getting into a cycle where they're using their current expenses to pay prior past due bills. And so they're always running behind. And again, just trying to look at what's going on in the community and how we can further support families for long-term stability and financial stability. I hope that helps provide some additional clarification.
Yeah, thanks, Janine. So I wasn't just specifically wanting to address FSI, but I was just wondering because there were multiple programs that are potentially being affected for this for next year. So I just was wondering how that was tying into these other programs and things for the totals that are shown, that arrow was showing for housing, shelter, and things of that nature, as well as, the FSI
Right,
situation.
right.
But I know that you guys do cover other programs within the community.
Yeah, I don't believe I'd have to go back and look at Arrow's spreadsheet, but I think FSI was the only one on that list that was looking at a potential reduction next year. I think there were some one-time funds that were provided, I believe, to not directions, I'm sorry, to Boley to fill the gap, and those came out of our FSI resource pool to fill that gap when the HUD funding didn't come through for permanent supportive housing. So that was just a one-time. But I don't believe there were other programs that were identified for reductions next year that were on that list. I'm trying to see if I can quickly pull up that list from our board meeting, but I haven't been able to pull it up yet.
I can just share one document too. We used to use this during COVID a lot, and just sharing in case anyone else needs quick data. But on the First Contact, formerly 211 website, you can look up for needs. You can do a date range. So this is just from January to end of March. Pinellas County, over 10,338 needs calls. Majority is housing. And then when you click on this, you can see, for example, the majority of calls are related to rent assistance payments, rent deposit. So you can also kind of search by range. So you might look at like last year during the same time frame and see what percentage, like for example, we're calling about homeless shelter, and compare it to this year, because we saw that like during COVID, where it was like there was a huge need for rent assistance, and then it started shifting to calls about needing homeless shelter. Like you could see that progression through that. So just want to share that out. It's there if you guys need quick resources and areas. They used to, I'm not as familiar with their new dashboard, but used to be able to even search by like zip code on calls, if you need to look at stuff more in your area too. All right, so it sounds like, just in summary on that topic, and then we can move on. We want to share it with providers and funders to take a look at the list. We're using the list primarily for our two councils to really look at what's in the system, where we may need to realign. If there's kind of storyline data we can look at, like for example, about realigning with new priorities, and maybe, if there's gaps or needs for different parts of the system and things like that. Is that what I'm hearing?
Yes.
Okay.
I believe so.
All right.
Yeah.
I don't know what's next on the agenda. Who's got the next item?
Public comment.
Any public comment? Going once? All right, well, I'll just say, we finally closed on a new housing project last week, Lealman Landing, which is 17 units. Construction starts next week, so I'm just happy to report after 3.5, almost 4 years, we're finally shovel in the ground. Thank you to all that has been a part of that journey.
Congratulations, Kevin.
Yeah.
Thank you. Hearing any other public comment?
I have one question for the group. I have a high school student. I guess Largo IB is having students do kind of community impact projects over the summer. looking at like research projects, and I have one that's looking at kind of the impacts of gentrification, so to speak, in our communities. And I didn't know, he's wanting to talk to some residents like about how they're impacted. I don't know if anyone's got any upcoming community events that might be good that he could attend and maybe talk to a few people, or if you have any other avenues that maybe I could send him to contact residents.
Ara, if you want to connect him to Dominique, we probably could have, or him or her, the student, spend some time at Bayside. Sometimes while they're in the waiting room, residents will interact with kind of surveys or questions or things like that.
Thank you.
Sure.
All right, hearing no other public comment, we'll call this, get a motion to adjourn the meeting.
So moved.
All in favor?
Bye.
Aye.
Anyone want to keep it going? Okay, hearing none, have a wonderful weekend, everyone.
Take care.
Thank you, guys.
Have a good
Have a good
weekend.
one.
For all the
Bye-bye.
great conversation today.
Thanks.
Yeah.